Hi guys, it's Dr. Blackett again with Yada Yada Health. Today we're talking about third trimester in pregnancy. Will life ever be normal again? That's what it'll feel like. It'll feel like life will never be normal, but I promise it'll be normal. Remember, I've taken the most common questions asked by my patients and I'm delivering those to you. First question I get asked is, what will my doctor's appointments consist of during my third trimester? Usually, you'll have visits in a routine pregnancy in your third trimester that are about every 2 weeks until the month before your due date, and then they'll usually be weekly. If you have any problems, then you may be seen more often, or depending on the situation, your visits might even be spaced out a little bit more. What are kick counts, and when should I start those? So our third trimester starts around 28 weeks, and that's generally when we want to start kick counts. Kick counts consist of being very aware of your baby during the day. You don't need to count kicks or movements all day long. You'll drive yourself crazy, but just be generally aware. If you get to the end of the day and you've been busy and you really haven't felt much movement, then drink something that's usually cold and sweet, and that'll wake the baby up. Maybe lie down, put your hands over your belly, and start counting. We usually want about 10 movements within 2 hours. They don't have to be actual kicks. Sometimes it might be shifting, but at least 10 movements within 2 hours. If you're not getting those movements, then you want to call your provider. What do contractions feel like? And do I need to be concerned about preterm labor? Everyone asks this question, particularly when you have not been pregnant before. What are contractions? And sometimes it's a little hard to describe. It might feel like the baby is balling up inside. You might feel a tightness, and if you pushed on your belly, it would be very hard to the touch. Contractions that are not painful are called Braxton Hicks contractions, and they're usually 30 seconds or so. You can get those at any time, particularly if you're on your feet a lot, if you're dehydrated, if you're stressed out, but you do want to be aware of the consistency. If you're having contractions and they're coming about every 10 minutes for an hour, your body is telling you that you're doing too much and that you ought to maybe lie down and rest. Drink a couple glasses of water. They should usually go away. If they don't go away and they're getting stronger and more painful, then you ought to call your provider because you'll likely need to be seen. How much can I lift in terms of weight during pregnancy? There's actually no established limit, but you do want to be aware that after about 30 weeks, your center of gravity is shifting out in front. And as it shifts out in front, then we tend to lean a little bit with our back and we get some lower back strain. This is often when a lot of my patients will get a little prenatal support belt to help give their back some extra support. If you're lifting a lot of heavy weight, then you're going to have more back pain and it's going to be a little bit of a rough go in this third trimester. So if you can, nothing more than about 15 pounds in the third trimester. What vaccines do I need to get during pregnancy? This is a great question. Right now, it's recommended that you get your flu vaccine and that you also get what we call a Tdap vaccine. The Tdap is for whooping cough. We found that we were having more cases of whooping cough in newborns in this country, and for a long time they looked at how they could prevent that from happening. They found the best way was to have the mother receive that Tdap vaccine in their third trimester, and they have shown that it has cut down on the rates of whooping cough in newborns. So that one in your flu vaccine, I'm sure eventually we'll be getting a COVID vaccine as well. What is the Group B strep test and when is that performed? This may be something you've read about. The Group B strep test is a little swab that goes right around the opening of the vagina around your 36-week visit. That's to test for the group B strep bacteria. It's very common. In fact, it's a bacteria that we can have as adults, and we probably won't even know that we have it because we're used to it. They've found that at least 1 in 4 of us have it. But newborns, as they pass through the vagina, they do not have any immunity, and if they pick up the group B strep bacteria, they can sometimes get sick. So we test everyone for it, and if you have it, we give you antibiotics through an IV during your labor, and then you usually do very well. We also do a urine culture a few times during pregnancy, and sometimes we'll pick up that group B strep in that urine culture. If we see it then we don't have to test you for it at your 36-week visit because we'll automatically treat you. You can have it with every pregnancy, or it may go away. So if you've had it, you usually will be retested every pregnancy. What is my provider checking on a cervical exam? Okay, guys, so your cervix is going to start being examined usually around 36 weeks. Remember, your cervix is kind of like the door to the uterus. So that's what needs to open up to let the baby come through. And your cervix is kind of like a fruit. In order to have a baby, it needs to ripen and it needs to soften and it needs to open up. So usually at 36 weeks, we'll check it initially, and then every week you come, depending on your discussion with your provider, you'll probably have it checked again. We check to see how dilated you are, and then also something called effacement. Most cervixes are about 4 centimeters long, and so effacement is kind of a shortening or a thinning of the cervix as it's getting ready to labor. And then we also check to see how low the head is in your pelvis. Know that as you start to dilate a little bit, getting ready for labor, that you might have a little more discharge towards the end of pregnancy. That's very normal, so don't be alarmed. Good luck, guys, with your delivery. We're going to talk again about postpartum stuff, so come back and see me when you're ready for that.